I'm about to give you the most important practical information that 28 years of working in a hospital has taught me to increase your chances of survival should you, or most likely once you have, contracted the coronavirus. Maintaining your health isn't rocket science. Let the infectious disease experts be the ones concerned with transmission rates, mortality rates, and the number of ventilators that your country has. I am going to give you one single piece of advice that is crucial to what you, only you, can do to increase your chances of survival, that I have seen time and time again be the difference between those who prevent or survive a pneumonia and those who do not. People don't die of coronavirus. They don't die from flu during the flu season. People die of asphyxiation from being unable to breathe from the pneumonia that is caused by the virus invading their lungs. The pneumonia is caused by the body's natural defense mechanism to produce mucus to capture the virus particles in your lungs and enable you to be able to expel them. You do that by coughing. A good, strong cough is your first and last line of defense against developing pneumonia. Most people, when they get sick, have a pathetic cough. Why? Because having a pathetic cough gets a person far more sympathy than a strong, forceful cough that will do the job of cleaning your lungs. Why doesn't anyone tell you this? Because if you tell a person who is sick that they need to harden up and do something they don't want to do, you will upset their feelings. And in the healthcare system, not upsetting a person's feelings is far more important than telling them bluntly what is necessary for them to do to maintain their health. Look at this video by a woman in England who is in the ICU with COVID.
If anyone is thinking of taking any chances, just take a look at me. I'm in the intensive care unit. I can't breathe without this. They've had to...
This isn't a video to help anyone. She made this video to get sympathy. How do I know this? Easy. No one who is really concerned about dying from developing pneumonia would put in that pathetic half-assed effort to cough and clear their lungs. If you are going to cough and clear your lungs, clear your bloody lungs. Sit up, bounce around, shake yourself, turn yourself upside down. Do anything you can to get the mucus and the phlegm out of your lungs. Don't lie in bed and go, woe is me. What you do is cough. That is how you cough. Now, me saying that is probably going to offend this woman and hurt her feelings. Guess what? Many people are going to get very sick and die because no one hurt their feelings and told them what they're doing is useless. This week, I went into the rooms of 11 positive COVID patients. 5 were older than me, 6 were younger. 10 out of the 11 were doing the single worst thing they could be doing for a person with a respiratory illness. But they were doing the best thing for a patient to believe they were getting sympathy for their disease. This is the biggest reason patients fall through the cracks in healthcare. The system treats their need for sympathy, not their disease. The 4 patients I saw who coughed, while I was in the room, coughed like this. You would think they wanted to get pneumonia because they sure as hell were not doing much in the way of preventing it. I told one guy that his cough was useless and he got upset. I am not sorry to be the one to tell you this. Nature doesn't give a shit about your feelings. Nature doesn't care if you are too embarrassed to cough. Nature doesn't care that it hurts to cough. Nature doesn't care that it is disgusting to cough. Nature doesn't care what your excuse is. All it cares about is if you are not going to clear your lungs, then you will suffer the consequences. That is how nature works. The doctors can't make you cough. Nurses can't make you cough. Medicine doesn't make you cough. Your mask isn't going to help make you cough. Financial stimulus and the Dow Jones making a new high isn't going to make you cough. Making a video for your friends on Facebook to show them how sick you think you are isn't going to help you cough. All the sympathy in the world can't make you cough. If you want to do everything you can from succumbing to pneumonia and the serious effects to your health that will cause, then the first step is get over yourself and cough like your life depends on it, because it does. That is how you cough and clear your lungs.